Welcome to the deep dive. We sift through mountains of research, notes, all that stuff, and boil it down to what you really need to know.
The actionable insights.
Exactly. Today, we're getting into something really vital, understanding key eye conditions, what they are, what they signal, and, crucially, when it's an emergency.
Yeah.
Our goal here is to give you that shortcut, to being properly clued in about your eyes.
Yeah.
We've been digging into loads of material, especially drawing from essential eye conditions, diagnosis and management.
Good source.
Yeah, pulling out the really crucial bits. We're thinking about your eyes not just for seeing, but as these amazing windows into your whole health picture.
It really is amazing. And what's fascinating is just how often these subtle eye symptoms, they can be the very first sign that something bigger, more systemic is going on. It just highlights how connected everything is and why it really pays to understand what your eyes might be telling you.
Totally. It always gets me just how much they reveal.
Right.
So let's start there. How much can our eyes actually tell us about our general health? Way beyond just, 20/20 vision.
Oh, a huge amount. It's quite astonishing, really. When a doctor performs a thorough eye exam, especially the fundoscopic exam where they look at the back of the eye,
Right.
they're getting a direct look at your blood vessels, your microvasculature.
Wow. Okay.
And that can show early warnings for things like high blood pressure, hypertension, or diabetes.
So literally seeing the effects before you might feel anything else.
Precisely. With hypertensive retinopathy, for instance, we look for these tiny changes. Things like where small arteries might be pressing down on veins, that's AV nicking,
Yeah.
or the arterioles might look a bit stiff, sort of reflective. We call that copper wiring. These are visual clues that high blood pressure is already affecting blood vessels, not just in the eye, but likely everywhere.
And you mentioned other signs.
Yeah, you can also see flame hemorrhages, little bleeds from those stressed vessels, and also cotton wool spots.
Cotton wool spots.
Yeah, they look like little fluffy white patches. They indicate areas where nerve fibers in the retina have been damaged because they're not getting enough blood. You see those in both hypertension and diabetic retinopathy.
Would someone notice these themselves, like looking in the mirror? Or is this purely for the doctor?
Almost always purely diagnostic. These signs are usually silent, no symptoms for the patient until things are pretty far along. That's why regular eye checks are so important.
Right.
Now, maybe one of the most concerning things we might find back there is something called papilledema.
Papilledema. Okay, that sounds serious.
It is very serious. So you have the optic nerve connecting your eye to your brain, right? If pressure builds up inside your skull, maybe from a tumor or bleeding, something major, that intracranial pressure can actually squeeze the optic nerve right where it enters the back of the eye. And it makes the nerve head swell up. That swelling is papilledema. It's like a red alert flashing on the dashboard, signaling a potentially dangerous neurological problem that needs urgent investigation.
So the eye really is a diagnostic window.
Absolutely. Into
Oh, wow.
systemic diseases, neurological issues. Quite incredible.
Incredible, yeah. And it's amazing what the eye reveals quietly about long-term stuff. But what about when the warnings aren't subtle at all? When vision just goes?
Right.
That's where it gets really urgent, doesn't it? The kind of sudden vision loss that demands immediate action.
Absolutely. When we talk about sudden vision loss, it's often a race against time. Every second counts. Take central retinal artery occlusion, CRAO.
Okay.
Think of it as a stroke, but specifically in the eye's main artery.
A stroke of the eye?
Kind of, yeah. It blocks the blood supply to the retina. The result is sudden, painless, often total vision loss in that eye. Patients sometimes describe it very vividly, like a curtain coming down over their vision.
Wow. A curtain?
Yeah.
That must be terrifying. What's actually happening inside to cause that?
Well, when that artery gets blocked, the retina, the light-sensitive tissue, it turns pale because it's starved of oxygen and nutrients.
Okay.
But there's often a tiny spot in the center, the fovea, which might get a trickle of blood from a different source. Against that pale background, it stands out as this distinct cherry red spot.
Oh, the classic sign.
Exactly. And the urgency here is paramount. Immediate transfer to the emergency department or an ophthalmologist is absolutely critical. We're talking hours, really, to try and restore blood flow and prevent permanent blindness. The retina just can't survive long without blood.
A true emergency, no question.
Definitely. And then there's retinal detachment, also very serious.
Which is like the retina peeling off.
Pretty much, yeah.
Yeah.
The retina separates from the underlying tissue that supports it. Symptoms are different, though. Usually involves new floaters like specks or cobwebs drifting in your vision, maybe flashes of light, like little camera flashes going off, and then often a shadow or a curtain effect, but it might seem to creep in from the periphery, from the side of your vision.
Okay, different from the CRAO curtain.
Right, but just as urgent. This needs prompt surgical intervention to reattach the retina. Otherwise, permanent vision loss is highly likely. So again, it's straight to the ED. These acute events really underscore how fast vision can disappear if you don't get immediate medical help.
So we've hit those really dramatic, sudden emergencies. But, a lot of eye conditions are more insidious, right? They creep up. How do you catch those? Because it feels like it'd be easy to just adapt or ignore the slow changes.
It is very easy to overlook them, and that's why understanding these more gradual conditions is equally vital. Take glaucoma.
Right. Heard of that one?
Think of your eye having internal pressure. Right. Intraocular pressure. There's fluid inside that's constantly being produced and drained away. In most types of glaucoma, the drainage system doesn't work quite right, so fluid builds up, the pressure inside the eye increases.
Okay.
And that high pressure slowly, gradually damages the optic nerve fibers, like squeezing a delicate cable over time.
And you don't feel it happening.
Not usually, not with the most common type. Open-angle glaucoma. It's often called the silent thief of sight because it steals your peripheral vision, so gradually you might not notice until significant damage is done.
Scary.
It is. That's why regular eye exams, including pressure checks, tonometry, are key, especially as you get older. Now, there is another type, closed-angle glaucoma, which is sudden and painful. Severe eye pain, blurred vision, nausea sometimes. That's an emergency.
Okay, so two very different presentations. How do you treat the common slow kind?
Treatment focuses on lowering that pressure. Usually starts with eye drops, things like prostaglandin analogs or beta blockers. Sometimes laser treatment or surgery is needed.
Got it. What else creeps up slowly?
Well, cataracts are incredibly common. That's just a clouding of the eye's natural lens.
It makes things blurry.
Exactly. Blurred vision, colors might seem faded, difficulty with night driving due to glare, that sort of thing.
Right.
The good news there is that surgery to replace the cloudy lens with an artificial one is very effective. Really restores vision well for most people.
That's positive.
And then there's macular degeneration. Age-related macular degeneration, or AMD. This one affects your central vision.
The sharp focus vision for reading and faces.
Precisely that. It makes daily tasks really difficult. It comes in two main forms. A dry form, which is more common and involves gradual thinning of the macula.
Okay.
And a wet form, which is less common but often more severe, where abnormal blood vessels grow under the retina and leak.
Leaky vessels.
Yeah.
Sounds bad.
It can cause rapid vision loss if untreated. Treatments for wet AMD often involve injections of medication into the eye or sometimes laser therapy to stop those vessels from leaking and growing. For dry AMD, it's more about monitoring and certain vitamin supplements that might slow progression.
So for all these gradual conditions, regular checkups are paramount.
Absolutely critical. It really brings up that whole issue of proactive health, doesn't it? You contrast these subtle conditions with the sudden emergencies we just discussed. Very different approaches needed.
Definitely. Okay, we've covered the sight-threatening emergencies and the slow burners. What about just painful eyes? When it just hurts. These sound like things maybe more people experience, but figuring out when a sore eye is serious must be key.
You're absolutely right. Pain is a common symptom, and it often comes from trauma or infection. A corneal abrasion is a perfect example.
Like a scratch on the eye.
Exactly. A scratch on the cornea, the clear front surface. Often from something minor, a fingernail, dust, getting poked, hurts. Feels like something's in there. Sensitive to light.
Yeah.
We diagnose it using fluorescein stain, a yellow dye that highlights the scratch under a special blue light. Treatment is usually antibiotic eye drops to prevent infection.
Simple enough.
Usually. But here's a key point. If you wear contact lenses, you must stop wearing them until the abrasion is fully healed. Contacts can trap bacteria and turn a simple scratch into a serious ulcer.
Good tip. Very important. What else causes pain?
Well, there's iritis, or anterior uveitis. That's inflammation inside the eye, specifically of the iris, the colored part. This usually causes a deep, aching pain, significant redness, often extreme light sensitivity photophobia, and the pupil might look smaller than the other eye.
Okay. Sounds more intense than a scratch.
It is. And it often needs more than just antibiotics. It requires prompt referral to an ophthalmologist because it can sometimes be linked to underlying inflammatory conditions in the body and needs specific anti-inflammatory treatment, often steroid drops.
Right. Needs specialist care.
Definitely. And one more to mention is herpes keratitis.
Herpes on the eye.
Yes, the herpes simplex virus, the same one that causes cold sores, can infect the cornea. It causes pain, redness, light sensitivity, blurred vision.
How do you know it's that?
Often on examination with fluorescein stain, we see these very characteristic little branching patterns on the cornea called dendritic ulcers. Looks like tiny tree branches.
Wow. Specific sign?
Very specific. Treatment involves antiviral medications, either drops or pills, and again, referral to an ophthalmologist is crucial because it can scar the cornea if not treated properly.
So it really seems like even with pain, you can't just assume it's minor. Could be a simple scratch, could be herpes, could be internal inflammation.
Precisely. It highlights the range, doesn't it? From everyday stuff like a minor abrasion to potentially serious infections or inflammatory conditions. Knowing the red flags and when to seek proper medical evaluation is critical. Don't just ignore eye pain.
Yeah. Wow. Okay, so we've covered a huge amount of ground here. A real deep dive. From those subtle systemic clues in the back of the eye
Hypertension, diabetes.
to the really sudden dramatic vision loss emergencies like CRAO and retinal detachment.
Where time is everything.
Then the slower conditions like glaucoma, cataracts, macular degeneration.
One's needing regular monitoring.
And finally, these common painful issues like abrasions and infections. We really aim to give you that informed perspective, cutting through the complexity without hopefully getting too bogged down in medical speak.
And I think the key takeaway is that understanding this stuff, knowing what to look for and when to act, it really empowers you. It's valuable knowledge for preserving not just your sight, but sometimes for catching other health issues early, too. Being proactive about eye health is so important.
It really is. You know, it makes you think, the eyes are relatively small, aren't they? But there's such powerful windows, not just onto the world outside, but deep inside our own bodies. What other quiet signals might our bodies be sending us all the time? And how can we get better at actually listening, at recognizing those warnings before they turn into crises? Something to think about until our next deep dive.